Okay, everyone. What we're going to do is we're going to, I know you're all ignoring me, but you're vaguely listening at the same time. As I say, we do need to stop if we're going to get the feedback. So I'm going to start by asking the wonderful Janet so what we're going to do is we're going to go round each table. Okay, everyone. The portcullis is down. The conversation is at an end. We'll now bring it back to everyone to talk through. So, Janet, are you going to feedback or?
Yes.
Okay, so why don't you come up here? Okay, everyone, we are in official feedback mode. That means everyone has to be quiet. Everyone has to listen.
I'm now either Judith or Hillary or somebody. Yes.
Oh, hold on. Right. Is everyone back with us? Okay, hold on. We got 10 seconds before everyone finishes their conversation then. Okay.
Okay.
Everyone happy? Everyone stopped?
So we had 5 questions, and I'm going to summarise the answers to those as we had them fairly briefly, and some of the issues that we pulled up then. Current status of insecticide resistance in Africa, clearly growing. We also talked about the status of insecticide resistance outside Africa, because this isn't just an African problem, although there's probably more resistance monitoring goes on and more capacity on the ground in Southeast Asia, for example, than there is in much of Africa, although that's improving within Africa. Implications of resistance. At the moment, we need to be able to differentiate between just resistance that we can see, i.e. there's a genetically inherited characteristic that allows an insect to survive a dose of insecticide that it would not normally have done, and something that is operationally significant, i.e. does that impact on our ability to control malaria? And because that's a multi-step process, it's not easy to answer that question. But that's an absolute key question that needs to be answered. Our best guess at the moment is that some of the resistance, but not all of it that is out there, does impact, and we now have some reasonable tools to be able to monitor that. The third one, how to combat insecticide resistance in countries using the tools that we currently have. So we have the global plan for insecticide resistance management that has been broadly circulated. That is the advice from the community that BCG, under WHO's auspices, pulled together. And I think it's fairly clear there that we are looking to moving towards bi-treated nets, ideally with neither of them having any current insecticide resistance associated, and using rotations and mosaics where that is reasonable. We talked about the evidence base that is there. There is a reasonable evidence base out there for that. That comes not only from public health, but also looking at the agricultural sector where they have similar issues with resistance. I think there's more that could be done, but we have some decent guidelines out there at the moment. And with current tools, I don't see that changing hugely. That has the backing not only of WHO, but I think of industry and academia as well. There aren't huge disagreements there in terms of how we should go about that. Does resistance lead to control failure? I think the answer to that definitively is some resistance will definitely lead to control failure. And the question is, how quickly will it happen within the sort of set? And how quickly will we lose some of the sort of set? But we didn't, to be honest, spend a lot of time on that. We spent more about talking about, well, how do we get new products to the market so that as and when it looks like we're starting to get failure, we have something to replace what we've currently got, because that's the big issue. What are the barriers to innovation? How do we sort those out? How do we make sure that we speed up that process and agree if we're bringing new paradigms to the market for resistance management that those paradigms are accepted? And there was a fair amount of discussion about the WHO pesticide evaluation scheme and the issues that still remains a roadblock in the system to innovation, and that the problems around that roadblock have not yet gone away. There is still quite a lot of work to be done there. We then looked at how countries actually managed resistance and implemented the global plan for insecticide resistance management, because it's fine putting a nice shiny document out there, but the countries actually have to be able to turn that into something real that you can do on the ground. We noted that the Global Fund actually asked the countries for their insecticide resistance management plan, and it's moved from being a tick box to they actually have to specify what they're going to do. But then the problem is, as one of the members of our table said, when people specify what they want to do, it goes to the Global Fund, and the Global Fund says, but we're not a technical body, they've put something down on paper, that must be fine. So there isn't a cross-checking of what's going on. The countries then put in their plan an amount of money to do that, but there's no follow-up to see whether they've done it, and we know that very often that money is not used to actually do the monitoring. So there needs to be a follow-up sort of system there. And there needs to be guidance, because it's fine getting data and saying, great, I've got resistance. What do I do about it? I don't know. Happens very frequently at country level. So we need to get some templates out there that says, this is how you ideally monitor. Here's the kind of results you get. This is the kind of template that you take forward. There are now a couple of country templates. I know one from Zambia. I know one from Equatorial Guinea at the moment that are fully worked through. They are fully supported by scientific monitoring and evaluation within the sort of set. At the moment, there is no mechanism anywhere for putting those generally out in the public domain. And so I've talked to Abraham and a couple of other people about this, but we're still struggling to say, what's the place that you use to get these more generally distributed to the people on the ground who need to develop their own plans in this format? So there are gaps there in the market as we move forward.
Just on that particular point, if there was one organisation, is there one organisation that could take that on, given the current way things are organised, or does it need something very complex collaboration?
If I had the answer to that, I wouldn't be asking the question on the sort of set. I know who needs to get the information. Yeah,
but knowing the current structure, which organisation could take a lead on it, for instance?
I'm going to open that to the floor. Joe?
There's a dilemma here. I'm speaking because Abraham, what the countries say is we're only giving it to WHO. We don't trust anybody but WHO. WHO we trust. Everybody else, we think that they'll steal our data, publish it without us, all that stuff. And, you only need that to happen 1 in 100 times, and the other 99 times it's for it. So, rightly or wrongly, that's the country's attitude. And at the moment, for WHO to get that capacity, given all the other things that are expected of it, how many of them have we heard just this morning? They've got much too much to do. So that's the dilemma, that's the difficult thing. It'd be nice if somebody else could do it, but if somebody else did it, the countries won't give them the data.
Okay. And Abraham, just in answer to Janet's earlier point about whether WHO can be a sort of bottleneck to innovation, do you have any response to that?
I'm not saying WHO. I'm being very clear here. Yeah. I'm talking about the WHO Pesticide Evaluation Scheme, which is not WHO, but it sits under that umbrella.
Okay, well, I don't care where it sits. It sits under your umbrella. So it's still...
Let me go back to the first point that was being discussed about database. Joe is right that countries were a bit uncomfortable in providing their data to an institution outside of WHO. So we thought when we launched the global plan for insecticide resistance management that we would perhaps identify an institution, and that institution will handle the data on behalf of behalf of WHO for member states, and that didn't really go down very well. So now we are forced to actually mobilize resources so that we collect this data and establish a database at the global level that will provide policy directions and support countries as well. But it really needs a lot of resources because we only need also to support countries in terms of establishing their capacities. Otherwise, the data wouldn't be really up to the mark. Having said that, you asked about the question on the WHO pesticide evaluation scheme is a bottleneck. We are very aware of this particular problem. It doesn't sit under our department. It sits somewhere else in another department. And we have.
Do you ever go and knock on their door?
We do.
And walk in and say, "What the hell's going on here?"
Yeah, we do. I think that's why the organization has now attempted to establish what is called a vector control advisory group that will help in shortening the process of assessing a product and eventually getting the product to the market. We hope that with the establishment of this committee, that process will be shortened. Having said that, there are still a lot of questions, like manufacturers are asking us, once that committee has made a recommendation, can we go ahead in selling our product so that we don't have to go through the pesticide evaluation scheme? These are some of the issues that we don't have answers as yet, and perhaps, will be tabled in our next meeting in July, and hopefully we'll be able to address
Great.
these issues.
We need to move on. But is the problem just that, is it bureaucratic? Is it there are too many layers? Is it that people are divorced from the actual problem and therefore they sit in their room and actually don't know the consequences? What is the block?
Part of it is that in the global malaria department there are 20 professionals, of whom one, and a consultant, are entomologists. Yet 60% of all the money that's spent on malaria control and 90% of the deaths saved by malaria control are entomological.
Okay. Can I just pick one point up?
And then we need to move on.
Because I think Abraham's right in terms of we need the data. But I think this isn't just about data, it's about data interpretation, and there are 2 steps to this process. And I remember a couple of years ago, the control program manager for Ethiopia happened to be at a meeting with me, and he came up in one coffee break and said, "I don't know what I should do. I've got resistance to all 4 classes of insecticide because we've done our WHO bioassays as we're supposed to. And clearly I've lost my vector control." And I just laughed and said, "You've got to be joking. You clearly haven't lost your vector control. We can sit down, we can look at your data, we can work out what's important, what's not. And there is still plenty you can do even in that situation." And that's the problem, that there is not only a lack of being able to generate the data, but understanding what data is important, what it means, and then what you can do. And it's almost the more difficult bit is the second bit, not the first bit. So great, let's put the data and the database together. But having a database will still not allow the countries to interpret that.
You should have an annual report.
Okay. No, I'm not going to take any comments or questions because we haven't got time, but have you finished?
I have.
Great.